So my name is Andrew Mize. This is going to be a head-to-toe examination. This is Mike. Mike, do you agree to be a participant in this head-to-toe examination?
Yes.
All right, so with Mike's consent to do this, we'll go ahead and start the head-to-toe scenario. Prior to coming into the room, I'll ensure that I have all the equipment that I need. I'll ensure that I enter, wash my hands, and introduce myself to the patient. And so with that, we'll go ahead and start with that in the general survey. Good afternoon, my name is Andrew Mize, nurse practitioner student. And basically today, you're here for a routine checkup, and let's just ask some general orientation questions. What's your name?
Mike Marbury.
And what's your date of birth?
12/168.
And where are we at right now?
St. Mary's.
And what month are we in?
December.
Great. So Mike answers the orientation questions correctly. His mood and affect, his speech is all appropriate for the scenario. So next thing after the general survey, which he looks decent, not to be any acute distress, we're going to go ahead and go into the skin, which we will assess every body system. We'll assess the skin as we go through it. And we'll look at things like the color of the skin. His appears to be normal. He seems to be same temperature, warm to touch bilaterally. There's no cyanosis, no erythema, no jaundice, no open wounds or lesions at this time. And I think what I'll do is just go ahead, Mike, I'm going to pinch your forearms real quick to assess the turgor and hydration of the patient. Skin retracts appropriately and adequately. The patient appears to be adequately hydrated. And then from here, we'll go ahead and we will inspect the patient's head and face. And upon inspection, we can see that the head appears to be normal cephalic, atraumatic, and his hairline is evenly distributed, normal texture. The scalp does not appear to have any flaking, no lesions, normal texture. Now we'll go ahead and palpate the head. Again, doesn't appear to have any masses, any lesions, anything like that. Mike, is there any tenderness as I palpate?
No.
All right. And then I want you to, while the TMJ, I want you to open and close your mouth. Any tenderness with that?
No.
Great. And then I'm going to also palpate your sinuses. Any tenderness when palpating your sinuses?
No.
Okay. And then I'm going to have you sniff this, and I want you to tell me what it smells like, okay?
Coffee.
All right. So it appears cranial nerve number 1, the olfactory nerve, is intact. And Mike, I want you to raise your eyebrows, and I want you to squint your eyebrows. Give me a big old smile, puff out your cheeks, and it appears that cranial nerves number 7 is intact. And then from here, I'm also going to test your sensation. All right, tell me, does this feel sharp or dull?
Dull. Dull. Dull.
And does one side feel different than the other?
No.
They feel about the same?
Yeah.
All right, cranial nerve number 5 is intact. And from here, I want to go ahead and I want to inspect the patient's eyes. And looking at the eyelashes, and the eyelids, they appear normal in texture, smooth, contoured. Lashes appear to be evenly distributed. And looking at the sclera, Mike, with your head straight, just go ahead and look to your left and right with your eyes. Sclera appears to be white. I'm just going to pull down here a little bit, check your conjunctiva, and they appear to be pink and moist. And then from here, I want you to keep your head straight and look at my finger. And I want you to look and follow my finger, but keep your head still. 6 cardinal gazes. He follows the finger conjugately. There's no nystagmus. It appears cranial nerves 3, 4, and 6 are intact. And from here, we're going to go ahead and check his pupils. Look good. Look straight at me. Look at my nose. Pupils are equal, round, reactive. Pupils are equal, round, reactive, and accommodating to light and appear to be about 4 millimeters in size. And then from here, Mike, I got a Snellen chart that holds about 14 inches in front of you, and I want you to read. Go ahead and cover your left eye. And with your right eye, give me the best you got.
DHJBS.
And then go ahead and close your eye and do the same thing with your left.
EF. ZO.
All right. And it appears the patient's vision is 20/20. Then from here, we are going to go to our otoscopic exam. And I'm going to check the left and the right eyes for the red reflex, retina, vessels, optic disc, and any kind of hemorrhage or anything like that. So you can look straight at me. In both eyes, there do not appear to be any hemorrhaging, any aneurysms, the optic disc visible, and red and orange in color. The next thing we'll move on to is the ears. And basically inspecting the patient's ears first, and the inspection appears to show that the ears are symmetrical, that the color is, the ears are symmetrical, the color is normal, there's no erythema, there's no jaundice, and there's no cyanosis, there's no lesions, does not appear to be any deformities. And then basically what we'll do now is we're going to palpate the auricle and the tragus. Okay. Any tenderness at all there?
Nope.
Mastoid process?
Nope.
Okay. And then from here we will go ahead and do the otoscopic exam and look into the ear canal. The ear canals on the left and right are patent with no earwax impaction, and also the tympanic membrane is visualized and gray pearly in color. Mike, next thing we're going to do now is what we call the whisper test. I'm going to stand behind you. I'm going to whisper a couple words, and I want you to go ahead and repeat those back to me, okay?
Okay.
All right, go ahead and close your left ear. Blue Jays 1, 2.
Blue Jays 1, 2.
All right, go ahead and close the other ear. Blue Jays 3, 4.
Blue Jays 3, 4.
Okay, so Mike was able to adequately hear the words that I whispered to him, Blue Jays 1, 2, and Blue Jays 3, 4, passing the whisper test. The next test that we'll do will be the Weber's test to assess the hearing as well. So Mike, what I'm gonna do is I'm gonna activate this tuning fork. I'm gonna hit it, activate it, I'm gonna sit on your head, and I want you to tell me if the sound is more on one side or the other, less on the other, or if it's the same on both sides.
Same.
All right, so the sound is the same on both sides for the patient. Now we'll go ahead and move on to the mouth and look into the mouth, and we will look at the teeth and the tongue, your uvula, mucosa, and your tonsils. So go ahead and open up wide. Appears to be approximately 28 teeth, covered in a line, no obvious caries or deformities noted with the teeth. And the tongue, go ahead and stick your tongue out. Tongue appears to be midline with a normal papillary pattern. The mucosa is pink and moist. And then go ahead and stick your tongue out again. Say ah. The uvula rises with phonation. And then real quick, Mike, stick your tongue out one more time. All right. And tonsils appear to be 1+. Okay. And with that, sticking the tongue out look great. So your cranial nerve number 12 is intact. And go ahead and shrug your shoulders for me. Cranial nerve number 11 is intact. Next, we're going to move down to your neck. Your trachea appears to be midline with no deviations. I'm going to auscultate for bruits, and basically I want you to take a deep breath in, a deep breath out, and hold it while I listen to your left and right side of your carotids. After that, I'll step behind you, and I'm going to palpate your carotid while you take a swallow for me. Does that sound good? Mm-hmm. All right. So I'm going to take a deep breath in, and out and hold it. Okay. All right. No bruits heard. So now I'm going to go behind you, and I'm going to palpate your thyroid while I take a swallow for me. All right, Mike, go ahead and put your chin down a little bit and go ahead and take a swallow. Okay, great. No thyroid megaly. And then from here, I'm going to palpate the different lymph nodes from the occipital to the post, the preauricular, the mandibular, submental, post, and anterior cervical chains. So go ahead and we'll start with the occipital, and then the post-auricular, the preauricular, the tonsillar, submandibular, submental, and then the posterior chain and the anterior chain. Okay, no lymphadenopathy noted. Now from here, I'm going to go ahead and inspect, palpate, percuss, and auscultate your anterior chest. And basically, the bony structures seem to be symmetrical, intact. The skin is, again, warm bilaterally to touch, normal in color, no erythema, no jaundice, no open wounds, no lesions, no redness. The patient does not appear to be in any acute distress. So then we're going to palpate the chest, looking for any differences, noting any tenderness. Mike, anything tender?
No.
All right, now we're going to go ahead and palpate. Any tenderness?
Nope.
Okay. And then from here, after the palpation and percussion, I'm going to find your PMI, which is approximately mid-fifth midclavicular line, fifth intercostal mid-clavicular line, and now to auscultate your lung sound. All right, so your lung sounds are clear bilaterally, and from here I'm going to listen to your heart with the belt and the diaphragm of the stethoscope real quick, okay? So we will start with the diaphragm, goes to the aortic, pulmonic, Herb's point, tricuspid, and mitral. Okay, now we'll switch to the bell and the aortic, pulmonic, Herb's point, tricuspid, and mitral. Okay. S1, S2 heard, no adventitious sounds. And again, lung fields are clear so far bilaterally. And then from here we will go to the posterior chest. So again, upon inspection, the bony structures appear to be symmetrical, skin appears to be normal in color. There is no open wounds or lesions, no erythema, no jaundice. The skin is warm bilaterally. The spine appears to be midline and everything appears to be symmetrical. I'm going to palpate, and is there any tenderness at all?
No.
Okay. I want you to say 99.
99. 99. 99. 99. 99. 99.
No tactile fremitus. And from here, we'll go to percussion. Comparing each side to the other. And then I'm going to, Mike, I'm going to tap on your left and right flanks. I'm going to test for your costovertebral angle tenderness. This kind of just checks on the kidneys, okay?
Okay.
And let me know if you have any tenderness. Any tenderness at all there?
No.
Okay. And then from here, I'll go ahead and auscultate the lungs again. Deep breath in. Deep breath out. So Mike's lungs are clear bilaterally, no adventitious sounds. So now that we've done your anterior, posterior, chest, lungs, and whatnot, we're going to move on to your abdomen. So what I need you to do from here is just to lie flat on the exam table. Okay. So now, upon inspection of the abdomen, I'm looking at the contour and the symmetry, making sure there's no visible pulsations, and the contour is rounded and does not appear to have any visible masses. Before I go into palpation and percussion, I will auscultate all four abdominal quadrants. All four abdominal quadrants, normal, active bowel sounds. Now I'll go into light and deep palpation, then to percussion. Any tenderness with that?
No.
Okay. You go a little deeper with deep palpation. And then try to palpate the liver, and the spleen, and then the kidneys. Okay. No organomegaly, no masses are palpated. So computer back on here. Okay. So then for the next thing we'll do is the percussion of the abdomen. Okay. Normal tympany is noted in dullness over organs as expected. Nothing unusual there. And then the specialized test that we will do here will be the Bloomberg sign. Basically, Mike, I'm going to press on your right lower quadrant and then quickly release, and we're going to assess for any tenderness or possible peritonitis. All right, Mike, pushing down hard, release. Any tenderness noted? No. Okay, no tenderness noted during that exam. All right, Mike, you can go ahead and take a seat back on the edge of the exam table. Thank you. So next, Mike, we are going to assess for your vasculature, and I'm going to check your capillary refill and all your fingers. Capillary refill in all 10 fingers are less than 3 seconds. Then from here, I'm going to assess your pulses. I'll start with your carotid, then I'll go down to your brachial, radial, and then to the top and the back of your feet, okay? Okay. Pulses are +2 bilaterally from top to bottom, and no edema noted as well in the top or the lower extremities. And then from here, we're going to assess some neurological things. We've already established that the patient is alert and oriented ×4, and then also we'll just do some more sensations here. Mike, I want you to close your eyes for me. How's that feel to you?
Soft.
How's that one?
Soft.
How about here?
Soft.
There?
Soft.
Here?
Soft.
Here?
Soft.
All right, and then one more time.
Sharp.
Good job.
Sharp. 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 Sharp.
Any difference in sensation at all from one side to the other?
No.
All right, so the sensations are intact, and now I want you to go ahead and stand up for me. All right, we're gonna do what's called the Romberg test. Basically, I want you to stand with your feet together, and then in a second, I'm gonna have you close your eyes, and I want you to stand there and keep your balance, okay? And we'll give that some time, and then I'll tell you to open your eyes back up, and then we can sit back on the exam table, okay?
Mm-hmm.
All right, so now Mike, go ahead and close your eyes. All right, great, you passed. Go ahead, and now you can take a seat back up onto the exam table. And then what I'm gonna do now is just basically, I'm gonna check your deep tendon reflexes. We'll do your biceps, we'll do your triceps, we'll do your radial, and then we will do your patella, okay? Okay. Good. Okay. Great. And then patellar. Okay. Deep tendon reflexes are intact. And then from here, we'll move on to the musculoskeletal examination, where basically we're going to check for scoliosis, spinal alignment, which we kind of already did initially, but we'll go ahead and do it again. So Mike, what I'm going to have you do is I'm going to have you stand up and then bend forward, just checking the alignment of your spine. All right. The spine appears to be midline and symmetrical from left to the right, no deviations. Okay, good job. Go ahead and take a seat for me. And then lastly, we'll go ahead and check range of motion and strength on the upper and the lower extremities. So Mike, go ahead and put your arms out, and then go ahead and put them up, put them forward, hands up and down, same thing, come down, up and down that way. Okay. So upper extremity range of motion is 5 out of 5. And then Mike, go ahead and stand up for me one more time. And then go ahead and kick your leg out. There you go, kick your foot out. And same thing with the other one. All right, great. Go ahead and take a seat for me. The range of motion on the lower extremities is 5 out of 5. Go ahead and put your gloves up. All right, go ahead and pull against my arms. And go ahead and push against me. Great. Same thing with your legs, push against, pull back. Once you push on the gas, all right, push back over your feet. And strength on upper and lower extremities is 5 out of 5. And then lastly, for our final musculoskeletal exam, we're going to do the straight leg test looking for lumbosacral nerve irritation. Go ahead and lay back for me one more time, Mike. Great. All right, now I want to go ahead and raise this leg here. Hold it up. Put it down. Now this one up. And then bring it down. Any tenderness or pain at all, lower back or legs?
No.
No tenderness or pain, lower back or legs. All right, go ahead and sit back up. Thank you, Mike. This concludes our head to toe exam. Thank you very much.